I'm sorry you don't feel good. My name is Ann Lackold. I'm going to be your nurse today.
Okay.
Okay. Did I pronounce your name correctly?
Yeah.
Okay. Did you know you have one pink nostril and one brown nostril?
Yeah.
Okay, I'm sorry. I didn't mean to point that out. That wasn't very nice of me, was it?
It's okay.
Okay. Trust me, I've done that before. So, do you have a pronoun that you prefer? Would you rather be called Miss or Mr. or her or he?
He.
Oh, he? I'm glad that I asked. Whoops, that was, oh well. How old are you, Spiffy?
I'm 21.
Okay. And do you work? What's your occupation?
I'm currently a student.
Okay. Are you married, Spiffy?
No, I'm single.
Okay. Is there anybody in that is with you today that can give me any sort of like history, or do you want to give the history? You feel well enough to do that?
I can do that.
Okay. What's going on with you, Spiffy? How are you? What's going on?
I have a fever that's been bothering me and some other symptoms.
Okay. So what other symptoms do you have besides a fever?
I've had a cough for the past 2 days and some nasal congestion and discharge, fever, difficulty breathing, and I've gotten sick once.
When you say sick, do you mean you threw up?
Yeah.
Okay, so have you been feeling nauseous since then, or has it gone away once you threw up, or?
It kind of comes and goes.
It comes and goes? That sucks. That's one of the worst things. I hate it when I feel nauseous.
Yeah.
When you said nasal discharge, what color was it? Was it like green, or was it yellow or clear? What kind of nasal discharge was it?
It's kind of water and it looks kind of green.
Okay, so it's kind of watery green?
Mm-hmm.
Okay. So, when you, let's see. Do you have any sort of pain or anything?
No, not really any pain. I've been coughing quite a bit though.
Okay, just pain or no pain? Coughing. Does your chest feel heavy?
No.
When you cough, is anything coming up? Like, do you feel yourself cough? Is it a dry cough, or do you feel when you cough, does something come up with it?
It's pretty dry.
Okay. So you don't feel like a cough and then kind of like you cough it and then you swallow it, or are you producing any sputum or any like green discharge or anything when you cough?
No.
Okay, so basically you're not really in so much pain, but it's just like a dry hacking cough with like a green discharge. How about, do you have a sore throat or anything like that with that?
No.
Do you have any difficulty breathing?
Yeah, a bit.
Okay. Do you feel like you have an increase, are you having a hard time walking around? Are you losing your air when you walk around?
Yeah, I get pretty winded quickly.
Okay, so you're getting winded when you with exertion?
Yeah.
I forgot the question I asked. Spiffy, I forgot the question I asked before I asked if you got winded with exertion. Oh, if you had difficulty breathing, and you said you did?
Yeah.
Is it even when you're quiet and sitting around, are you having a hard time breathing?
Yeah.
Okay. Okay. Are you on any medicines?
Yeah, I've been taking Mucinex,
Okay.
Tylenol,
Oh, I'm sorry. I missed that. I missed that, Spiffy. What was that?
Tylenol,
Tylenol. Okay.
Pepto-Bismol, and Zantac.
Zantac.
Mm-hmm.
So Mucinex, Tylenol, Pepto-Bismol, and Zantac. Have you been to the doctor and have you gotten any medicines from the pharmacy?
No, not lately.
Okay. Alrighty. Are you allergic to anything, Spiffy?
Not that I know of.
Have you been a smoker, Spiffy? Do you smoke?
Yeah.
How long have you been smoking?
Probably the last 3 years.
And how much do you smoke per day? And
About 3 to 4 cigarettes per day.
okay, just normal tobacco.
Yeah.
Have you used any marijuana or anything like that, or any drugs that you shouldn't be using?
No.
Okay, so just smoking for the past 3 years, 3 to 4 cigarettes a day.
Yeah.
Okay. Have you had any childhood illnesses?
Acid reflux.
Oh, that sucks. I'm sorry.
Mm-hmm.
Have you had any adult illnesses?
None until recently.
Okay, so just the difficulty breathing.
Mm-hmm.
Do you have any family history of any chronic diseases?
My mom has asthma.
Your mom has asthma?
Yeah.
So anything else? Hypertension?
No.
Coronary heart disease?
No.
Elevated cholesterol?
No.
Stroke?
No.
Diabetes?
Not that I'm aware of.
Okay. Renal disease?
No.
How about lung disease besides asthma, like COPD or just asthma?
Don't just asthma.
Okay. I'm gonna go back. How high was your fever running, Spiffy, when you were at home?
When I was at home, it was about 39.3.
Okay. So a little bit elevated. Did it ever get higher than that?
I think it was higher when I came home.
Okay. Did you take Tylenol to make that fever go down?
Not since I got here.
Okay. Were you taking Tylenol when you had that fever?
Yeah.
Oh, so that was a fever even with Tylenol.
Yeah.
Okay. So how has your general health been, Spiffy? Like up until now?
I've been okay. I haven't had to go to the doctor for anything besides my yearly flu shot.
Okay. And they've never found anything on your yearly checkup?
No, they said I've been pretty healthy.
Okay. Any lumps or bumps or rashes or itching anywhere? Is your skin okay?
That I've noticed.
Okay. Any changes in color and moles or anything like that?
No,
Okay. How about, have you had a headache?
no,
Dizziness?
no, dizziness.
Any vision changes?
Not that I've noticed.
Any hearing, or is your hearing been okay? Any ringing in the ears or anything?
My ears have been okay.
Okay, and we talked about your nose was stuffy. Any like nosebleeds or anything?
No, no, no.
Can we pause?